Hi, I'm Kate Lisk. This is going to be my medication administration video. So I've got my 4 drug cards here. On the backs of them, I have written just my labs for the day. So if I turn them over, it's because my labs are on the back. I have my MAR, front and back, and I have my provider order here. Got my med cart set up. I have gloves, hand sanitizer, med cup, water cup, my markers, and I do have a pill cutter here in case I need that. And with that, I'm going to get started. Hi, my name's Kate. I'm a student nurse here at Southwest Tech. I'm going to pull the curtain for privacy and provide hand hygiene. Could I just get your first and last name, please?
Joseph Smith, 10-5-54.
All right, there we go. All right, Joseph, and do you have any allergies that
No.
you're aware of? Okay. All right, and are you comfortable laying
Yes,
down?
I am.
Okay. All right, so it looks like, in looking at the provider orders here, it looks like we have just an order to do your afternoon medications today. So I'm gonna go out to the med card and take a look and see what all we have scheduled. One thing I did notice is that you do have some PRN pain medications. Are you in any pain today?
No.
Okay, so we won't be taking that one probably. I did take your vital signs earlier. Your blood pressure was at 119/74. Your temp was at 98 degrees. Your pulse was 68. Your respirations were 14. So everything looked really good with that. All safe for medication. And you said you don't have any allergies, correct? Okay. Do you have any questions before we start? Okay. All right. And as long as you said you are comfortable just lying there. So I'm going to make sure you've got your call light, the bed's low and locked, side rails are secured, your tray table is there, your call light is within reach, it's attached to your pillowcase here. So what I'm going to do is I'm just going to step out of the room, go back to my med cart, get your meds prepared, and then I'll be back in shortly, okay?
Okay.
All right, and if you need anything in the meantime, just press the call light, okay?
Okay.
All right. All right, pull the curtain back open. Hand hygiene. Okay, so the first thing that I am going to do is take a look at the meds on my provider order versus my MAR. So I've got Joseph Smith, 10-5-54, Joseph Smith, 10-5-54, and we've got 4 drugs ordered. So we've got digoxin, lanoxin, 0.125 milligrams. On the back here, digoxin, lanoxin, 0.125 milligrams. That's PO daily for CHF and AFib. For CHF and AFib, the order is active and the med has not yet been given today. Then we have Joseph Smith, 10-5-54, 10-5-54. We've got furosemide Lasix, 40 milligrams. Furosemide Lasix, 40 milligrams, and that's PO twice a day for CHF. So PO twice a day for CHF. The order is active, and the medication has not yet been given today. Then we have Joseph Smith, 10-5-54, 10-5-54, and we've got warfarin Coumadin, 5 milligrams, warfarin Coumadin, 5 milligrams, PO daily for AFib, and we've got PO daily for AFib. The order is active and the medication has not yet been given. And then we are going to go down to the PRN med. We've got here, there it is, there and over here. Okay, so Joseph Smith, 10-5-54, 10-5-54. We've got oxycodone, 5 milligrams, acetaminophen, 325 milligrams, or Percocet, and oxycodone, 5 milligrams, acetaminophen, 325 milligrams, or Percocet. We've got 1 tablet, PO, every 4 hours. So 1 tablet, PO, every 4 hours. and that's PRN for pain rating 1 to 4. PRN pain rating 1 to 4. The order is active and that medication has not yet been given today. And then we have another PRN there, Joseph Smith, 10-5 of 54, 10-5 of 54. Same medication, oxycodone 5 milligrams, acetaminophen 325 milligrams, or Percocet. Oxycodone 5 milligrams, acetaminophen 325 milligrams, or Percocet. This one is 2 tablets PO every 4 hours and 2 tablets PO every 4 hours. And that's PRN for a pain rating of 5 to 10. And PRN pain rating of 5 to 10. The order is active and that medication has not yet been given. All right, so now that I verified the provider order against the MAR, I don't need the provider anymore. So I'm gonna put that away. That put away. All right, and we're gonna run through these drugs to see which ones we are going to give today. The first one I'm gonna knock out is the oxycodone acetaminophen, also known as Percocet. So for nursing considerations we can look at with that is assess pain, such as pain characteristics, and have them rate the pain. We wanna check their INO, be cautious of any physical dependence, and also check for things like dizziness, drowsiness, and hallucinations. Joseph denied any pain today, so we are not going to be giving that medication. All right. The next drug, the furosemide Lasix. Some things we're going to look at with nursing considerations on that is fluid volume status. Check their INO for sure. Definitely need to watch their output. We can listen for crackles in the lungs. Check for any dehydration, assess their blood pressure, and monitor for symptoms of Stevens-Johnson syndrome. A couple of labs that we would check with furosemide and Lasix would be potassium and sodium. And the normal range for potassium is 135 to 145. Joseph's this morning was at 130, so it is low. His potassium, a healthy range, is 3.5 to 5.0, and his was at 3.2, so his potassium is low as well. So with the sodium and potassium both being low, we are not going to give the furosemide because we don't want to flush any more of that out of his system. And then I've got the warfarin Coumadin. Nursing considerations, we need to monitor blood studies like his hematocrit and platelets. We can check for occult blood in the stool. We also want to assess for bleeding gums, black tarry stools, and some labs. Oh, we can also check for fever and rash on that. And labs we would check on that would be INR. The healthy range for the INR is a 2.0 to 3.0. His INR today was a 2.2, so we are going to give that med to keep it in that healthy range. And the last med on our list is digoxin, also known as Lanoxin. So some things to check for. We would check the apical pulse for a full minute. If that pulse is less than 60, we cannot give that medication. We also want to check for edema, and so there's a bunch of labs we can check. We can check sodium, potassium, ALT, AST, and we can also check the digoxin level. So today, Joseph's digoxin level was at 2.2. The healthy range is 0.8 to 2. So with him being at 2.2, we don't want to give digoxin anymore because we don't want to risk toxicity for that. Okay, so that being said, the only drug we're going to give today then is that warfarin. So I'm going to go to my med cart here, get the warfarin out, and all right, so back to his MAR Joseph Smith, 10-5 of 54. We've got warfarin Coumadin, 5 milligrams PO daily for AFib, with an active order, and the medication has not been given yet today. And here I've got warfarin Coumadin, 5 milligrams. It expires 6 of 2036. The packaging is intact. The pill is intact. His order is for PO, and this is an oral tablet, so everything is good to go on that one. And again, that's his only medication gonna be taking today, so we'll go ahead and start with the second med check right away. So I've got my cup here. So again, Joseph Smith, 10-5 of 54, warfarin Coumadin, 5 milligrams PO daily for AFib, active order. The medication has not yet been given. And here I've got warfarin Coumadin, 5 milligrams. The order is for PO. This is an oral tablet. Expiration date 6 of 2036. And the packaging is intact, as well as the tablet is intact. So I'm going to go ahead and put that in the cup. All right. And before I go in his room, I'm going to go ahead and circle the ones that we are not giving. So we're not giving digoxin, furosemide, and the Percocet. And I just realized I'm doing these the wrong time of day because it is currently 15:10. Okay, so sorry about that. Redoing this, circling the meds that I did not give under the correct column. And today is 2/25/26, and it is 15:10 KL student nurse. 2/25/26, 15:10 KL student nurse. 2/25/15:10 KL student nurse. And 2/25/15:10 and KL student nurse. Okay, so warfarin Coumadin will be the one that we are giving. Got my med cup here. I've got, this will be my cup of water, and I'm going to touch all of this. So I'm going to hand sanitize before I go back into my client's room.
Hello.
Hi, Joseph. It's Kate again. I'm going to pull the curtain to provide for privacy. I'm back. I'm Kate. I'm your student nurse here at Southwest Tech. Okay. Can you tell me your first and last name and date of birth?
Joseph Smith, 10-5 of 54.
Okay, and just gonna check your wristband again there. All right, looks good. And Joseph, do you have any allergies?
No.
No. All right, and are you comfortable sitting there
Yes.
in position? All right. So like we talked before, I'm going to be doing your afternoon medication administration, okay? When I was in here earlier, you said that you weren't in any pain today. Is that still the case?
Yes.
Okay. All right, so we're not going to be administering any pain medication for you today. And it looks like based on your labs, there's only one medication we will be giving you today. And it's going to be your warfarin, or you might know it as Coumadin, okay? It looks like you've taken this before, but just as a refresher, this drug is an anticoagulant, or you might know it as your blood thinner maybe, and it's to help prevent you from getting blood clots, okay? And based on your lab results, we are within a healthy range. Your lab results came back today. Your INR was at 2.2, and our normal healthy range is 2.0 to 3.0, so we're good to get that med.
Okay.
All right, just to let you know, there are a couple of common side effects that go along with taking this medication. You may experience some nausea, some cramping, a rash, or fever. If you were to experience any of those, please turn on your call light, let me know so I can come in right away. I will be coming back and checking on you in about 30 minutes, because if you're to have any of those side effects at all after taking an oral medication, most of those effects take place within the first 30 minutes. So I'll come back and check on you. If you are having any side effects at all, what I would do is I would withhold your next dose, so we wouldn't take the next dose. I would assess all your vital signs again and take your blood pressure, temperature, and all of that. And then I would contact your prescriber as well as the pharmacy, and I would document those side effects per my agency policy, okay? All right. I'm not sure if I performed hand hygiene when I first came into your room, so I'm doing that now. And I also would have drawn the curtain to provide privacy when we came in. All right, and you're comfortable there and ready to take your medication? All right, do you have any questions about the medication or the procedure before we start?
No.
Okay, and you did say that you were okay taking your medications orally in a pill form with just water, correct?
Correct.
Okay, all right, so let me just put my gloves on here. Hands are nice and sticky from all that sanitizer. Alrighty, so Joseph, I'm just gonna run through a quick med check here. I've already checked it as I put the meds on my cart, but we're gonna do it one more time before I give it to you, okay? Alright, so Joseph Smith, 10-5 of 54. The only med we're giving is warfarin, also known as Coumadin, 5 milligrams orally. And here in this med cup, I've got warfarin, Coumadin, 5 milligrams. And it says the order is orally, daily for atrial fibrillation. So orally, this is an oral tablet. Okay, the order is active and it has not been given yet today. So Joseph, and just to show you, it's a fresh package. The integrity is still intact. The pill is intact. So I am gonna tear this open, put that pill inside of this cup, and then I've got a cup of water for you. So here's your pill, and here's your water. All right, and you got that pill down okay?
Yep.
All right, perfect. And I would throw these away. I'm saving them for the sake of the videos. Remove gloves. All right, and Joseph, I'll just document that. So it is 15/15 on February 25th of 2026. All right, so 15/15. KL student nurse. Okay. All right, Joseph, so like I said, I will be back in about 30 minutes to check on you. If anything arises, if you start to feel like you're having any side effects or you need anything at all, here's your call light. You just feel free to buzz me, okay? And I'll come right back in. Are you comfortable sitting there? Can I get you anything? I've got plenty of time.
No, I'm good.
Okay. All right, so I'm going to make sure your bed is low and locked. Make sure your side rails are secured. You've got your call light. Your table is within reach. I'm going to make sure that the room is risk-free of any falls. Now that I'm getting ready to leave the room, perform hand hygiene. The 5 moments of hand hygiene are before touching a patient, after touching a patient, before an aseptic procedure, after risk of bodily fluid exposure, and after touching patient surroundings or belongings. So on that note, I would leave the room. I've got my meds documented here. Again, circled the ones that were not given. I would upload all of this into OneNote and Schoology. If I found any abnormalities or deviations, I would document and report those per my agency policy. Just trying to think. Oh, if I had used any equipment, I would have sanitized it first. If I needed to use the pill cutter, I would have sanitized that before and after cutting my pill. If I needed to crush it or cut it, same thing. And yeah, I would have, I guess every time I went in the room, I would have donned PPE or gloves if it was necessary. For this particular skill, it was only necessary when I was handling the patient's medication. And one other thing I want to point out that I would have done before administering the warfarin was I would have assessed him for bleeding gums, or like to see if he had any cuts, scrapes, or anything like that, to see if he was having any issues with bleeding, because it does thin the blood and I want to make sure that he's not bleeding like crazy. Other than that, I think I am good, and that is the end of my video.